Okay, CPT JJ-CPV Evaluation and Management E&M Services Guidelines, page 4, part 1, right? Classification of Evaluation and Management E&M Services.
In addition to the information presented in the introduction, several other items unique to this section are defined or identified here.
The E&M section is divided into broad categories such as office visits, hospital visits, and consultations, right? And there's this little table of what the E&M services include, right? So that's our theory for today. Now let's do a problem. 1, 2, 3. Okay, JJ-RVA, page 267, exercise 134. This is a level 1 exercise, and it's a laceration of tibial nerve, nerve transposition, and suture. Okay, and the problem reads like this.
Surgery, nervous system. Patient comes, first off, it was the titles. Laceration tibial nerve, nerve transposition, and suture.
Right, now the problem.
Surgery, nervous system. Patient comes in through the emergency room with a laceration of the posterior tibial nerve.
Let me point that out. It's posterior tibial nerve. Can you underline posterior too? Because there's a difference in the frontal and the posterior tibial nerve, right? Okay, posterior tibial nerve, okay?
Then I do this one too.
Okay. Those are the keywords. Now the patient is taken
to the operating room where the nerve requires transposition and suture.
It requires two things. It has to be sutured and transposition. It means it has to be healed and it has to be change of place. The transposition is the changing of place. It's moving from one side to the other. Okay? So that is our procedure. Now we're going to come to 3 so you can give us the CPT code for this procedure. 1, 2, 3. Okay, the answer is 2 codes. 64840 and 64874. Okay, did you get that? If you got it, congratulations. If you didn't get it, let's give you some tips. Okay, the first tip.
First tip is level 2 difficulty. There are 2 codes.
There are 2 codes here, right? It's not just 1 code, but 2 codes because they're practically 2 procedures, the suture and the transposition, right? For the first code,
start with tibial nerve.
You go to tibial nerve. I think it's just one word. It's not tibial nerve. It's tibial space nerve, right? In the index, there is one tibial nerve, right?
Yes.
So there's no need for the forward slash. They don't send you to another place. It's just tibial nerve.
Okay.
There. You start with tibial nerve. If you go to the index, you're going to find tibial nerve, right?
I suppose so.
Okay, hold on. Let me double check this. Let's see. So we send you to the right place. Tibial. Oh no, you're right. Tibial is the title, and then you go to nerve. Sorry, my bad. Okay, so tibial is the title, and then the nerve is like a subtitle. So you start with tibial, and then you go to nerve. Okay. Now, the third tip is, since you are missing transposition, right? There's no transposition in the code that you just found, then you have to look in the
range of codes for an additional code that covers requiring transposition.
Just read all the range of codes, and then you're gonna find one of them that says, if there's a required transposition, use this additional code. That's how you get the second code. How do you know there's a second code? Because there's no transposition in your code for suture. So you gotta keep looking to cover the whole procedure. Okay, now the links to understand this problem. As usually, we have 3 main links. A pluses are the main links. The first one is, it just tells you where the tibial nerve is, right? If you don't know your anatomy or a review of your anatomy, you just open this and it'll tell you exactly where the tibial nerve is. The second one is, what is a laceration of a nerve, right? You're going to find out there an article that talks about laceration of a nerve. And the third one is an image that shows you what's a transposition of a nerve, which means that it's changing of sides of a nerve. If it's in this side, you just move it to the other side. That's transposition, right? And if you want to keep knowing about this problem, you just can click on the other additional links. But if you just want to get to the point and real quick, the first 3 links will tell you what it is. Okay, so those are our tips and our links, and we know the answer already is to code 64840 and 64874, but now we're going to count to 3 so you can pause the video and give us a path how we got to the code. Okay, so 1, 2, 3. All right, this is the summary of the whole problem. It's the surgery section of the CPT code book. Is a nervous system. The patient comes in through the emergency room with a laceration of the posterior, please underline, posterior tibial nerve, right? The patient is taken to the operator room where the nerve requires transposition and suture, right? So the code 1 is found like this. The main words are tibial nerve and suture, and the code 1 is found like this through the index.
First you go to index.
Go to the index.
Then you go to tibial.
Start with tibial.
Then you go to nerve.
Then you go to nerve.
Then you go to repair suture.
Repair and suture, and
posterior.
That's where this word is important. It's posterior, right? And it gives you just one code, right?
Right.
What's the code?
64840.
Okay. Now, the checking of this code in the tabular is found like this.
First, you go to tabular.
Uh-huh.
You start with the code 64840.
All right.
Suture of posterior tibial nerve.
That's our code. Now, you would end here if there was no transposition, but you're missing the transposition, right?
Right.
So, now we are going to try to find it by just going again to suture and nerve, and then seeing all the codes that we have there, and there might be someone that tells us that there's a transposition required. So the code number 2 is found like this. The keywords are suture, required transposition, and the code number 2 through the index is found like this.
First you go to index.
Okay.
Then you go to suture.
Go to suture again.
Then you go to nerve.
Go to nerve. Okay.
Then you have this range of codes.
Right. And now notice that this code that we found here is also in this range, right? So you could have found this way, but this is the direct way to go in through this code. But since we need an additional code for the transposition, we're going to look in all this range to see if we can find one that says transposition. So for that, we go to the tabular. So the code number 2 through the tabular is found like this.
First, you go to tabular.
Go to tabular, and you're going to analyze all the codes in that range, right?
Right.
Okay.
First, you start with this code, 64831.
Which is the first one, and what does it tell you?
Suture of digital nerve.
Okay, it means a nerve of the hand, right?
Yes.
Of the fingers. Okay, now you keep going. You can go one by one, but we have already made like a summary. There's still more here, and when you get to this one, it says what?
64874. Requiring transposition of nerve. This separately in addition to code for nerve suture.
That's exactly what we need. That's why we need a second code, right? So we have to use in addition to the first code that we found. That's why there is a go to again 64874, which is the additional code, and there's the equal sign. That's why we get the first code and then the additional code for the transposition right there.
Yes.
Okay, so that's how you get to the answer. Thanks for watching, and don't forget to visit our website, and also
you can subscribe to us in YouTube by clicking here for our new medical coding videos.
Okay. And you will get?
You will get up to 3 videos every day that we make. ICD-10, CPTs, all that's needed to pass the medical coding certification exams.
So don't forget to visit our website and subscribe to our videos. Thank you.
Goodbye.
Bye.